Okay, question 1. In this scenario, were there any laws violated? If so, which ones? Please explain and provide a reference for your response. The answer is yes. Ms. Rodriguez violated the law where she proceeded with treatment without prior PT evaluation as regulated by the PT Boards of California. In addition, the PTA also failed to provide necessary actions to help the patient after the incident and failed to document as required, which is a result of negligence and violation of legal duty of care. She also failed to report and document the incident, which is a breach of duty. Reference from PTBC and the American Physical Therapy Association Guide to Practice. Question 2. What should Ms. Rodriguez have done differently when she realized there was no prior evaluation? So Ms. Rodriguez should not have initiated any treatment for the patient. She should have notified the supervising PT and educated the patient and the daughter that the treatment would be deferred until the patient gets evaluated and a plan of care is created. Question 3. How else did Ms. Rodriguez fail to provide adequate care to patient after the fall? The PTA failed to immediately check the patient for any injury, provide first aid, and seek for emergency care as needed. She failed to document and did not notify the supervising PT. Question 4. In this scenario, is there a reason why Ms. Rodriguez went ahead with the treatment and who is liable in this case? Ms. Rodriguez may have proceeded with the patient's treatment due to the assumption that the patient evaluation was already done and she was also scheduled to see the patient. In this case, the PTA is liable since she forgot to check prior and did not provide the proper care after the fall incident. The PT may also be liable due to inadequate direction and supervision to the PTA. Question 5. What would you have done in this scenario? So before I go to the patient's home, I would have thoroughly reviewed the patient's chart, which implies that there is already a PT evaluation, so that I can also understand the patient's condition and I can provide proper treatment that aligns with the PT's plan of care. I will also ensure safety precautions throughout the treatment. Should there be any fall incident, I will assure to provide the necessary first aid, call emergency services if needed, document the incident, and to notify the supervising PT.